Hello there again. This is Unit 8, Respiratory Diseases for Plant and Animal Disease, AGRC 223. I'm going to try and stuff all this into this single 15-minute recording here. So let's get right to our content. The first respiratory disease that we'll talk about is pasteurellosis. It does affect cattle, sheep, and swine, somewhat fairly common out there when you talk about respiratory problems out on the farm. Again, a Pasteurella species virus is what causes this particular problem. And so you'll know this as shipping fever or pneumonia most of the time. And Pasteurella is something to be very aware of anytime you're moving cattle, stressing them, stressing livestock of any kind, because they certainly can become extremely sick. And sepsis means we have an infection running and pulsing through the blood system that carries that infectious organism kind of throughout the body and really makes an animal very, very sick quickly. You'll see a lot of treatment protocols for this one, a lot of antibiotic and viral things that go right to treating this specific disease on a regular basis, and many folks herd health management plan, very targeted with their veterinarian. So let's move on. The next one is the bovine respiratory disease complex, and so we're talking about several things here that we'll move on through the next few slides that can be problematic. That all kind of fit under the umbrella of the BRDC. These can be bacterial, viral factors, environmental factors, upper respiratory tract, lower respiratory tract. And so here we're talking about something usually associated with some other level of stress, some other stressor, whether it's weaning, shipping, commingling, parturition. And when we talk about morbidity and mortality rates, greater than 50% morbidity and greater than 10% mortality can be lost to BRDC. Morbidity, again, is sick loss. Mortality rate, obviously, then death loss. And certainly we can be having it caused by one agent or one pathogen or a combination of pathogens. So let's dive into some causative agents here. IBR is infectious bovine rhinotracheitis. Generally will have a fever associated with, and it kind of interferes with bodily function. BVD we talked about earlier, but you can have a BVD respiratory type that certainly is associated with some immunosuppression. Bovine respiratory syncytial virus then is a colonization problem of lung tissue, and it also causes immunosuppression, or basically your immune system does not work appropriately. And then a PI3 disease complex that also is, again, persistently infected animals. Again, that complex, if you look on some of your respiratory vaccination respiratory vaccination, excuse me if I can spit it out here, you'll see a 5-way, 7-way, 9-way that's targeted at these very pathogens right here. Pasteurella, Haemophilus, all in that BRDC complex. Clinical symptoms here, again, 5 to 10 day incubation period lots of times. The morbidity outbreak somewhere is around 20%. So assuming that we loaded up 10 head of calves on the trailer to move them to a different feedlot, you could anticipate a morbidity, a sick outbreak of about 20%. If you were monitoring body temperatures, it's probably more like 40%. So that doubling of that number is generally associated. It's a subclinical problem that they have. They may not totally break out with the coughing, the wheezing, the snotty nose, or whatever. But subclinically, they have some of the symptoms and some of the stressors there. Mortality may be 5% through the outbreak. So body temperature is 104 or higher. Discharge, like I mentioned, increased respiration rate or distress in breathing. And then sometimes, and this is in really bad scenarios, but I've seen it happen to calves, is actually you get some permanent damage to the respiratory mucosa. You can actually get adhesions in the lungs where the lungs can turn black and stick together, have scar tissue in them, and they never ever recover from that. Preventative measures simply reduce stress. And what I mean by don't multiply stressful operations. So if you can, try not to castrate, vaccinate, change feed programs, and change environments and change groups all in the same day. There's some there's some conflicting data out there on what to do there. Some will say if I'm going to stress them, I'm going to stress them all at one time and get it over with and deal with whatever consequences like these respiratory problems and just get it out of the way. And some will say I've got time to spread it out. I don't mind working animals that often. We'll spread out those stressful operations, and that way we'll decrease our health risk. That's up to you as a manager to do what you can. Do what you decide is best for your operation. Just understand the risks either way. Vaccination before that stress period will certainly help increase your immunity, immune response, and higher health plane. So things to consider. Sometimes the age of the animal has something to do with it, or nutritional status. For example, if you give a vaccination to an animal that's too young, sometimes they don't respond well and don't get much out of it because of the colostrum effect that they're still enjoying, which is a good thing, except you didn't get a lot out of your vaccine. Again, use live or killed vaccines depending upon the situation, and bottom line, work with your veterinarian on what to choose. Same thing in regard to treatment. You may just do a mass treatment of antibiotics before the clinical symptoms using penicillin, sulfonamides, or things of that nature that are listed here, whether it's IM, subcutaneous, or even feed-related, to go in and do some preventative or mass treatment. And you may add a fever reducer depending on what you choose. PI3, if we kind of revisit that here for a second, again, viral infection, spread airborne, contact with infected animals. So usually, again, stress-related, clinical symptoms, and those animals get gaunt and depressed. Temperatures usually pretty high, associated with a cough most of the time. And again, vaccination both for PI3 and IBR are in the same product most of the time. And here is IBR PI3 type animal. You can notice obviously the dark red nose, and this particular cow, he's experienced some bleeding out of the mucosa, really severe problem there. Again, IBR, we've somewhat alluded to a herpes-related virus, so you can find this in the respiratory, the reproductive, the eye. This actually is, there's an IBR version of pink eye. You can have an aborted fetus, so IBR is a really problematic pest out there. So it's spread by, again, airborne, contaminated equipment or carriers. Incubation time on this one is about 20 days. So you'll notice that a lot of these incubation times, if you remember from some of the other different units, not only in this class, but other ones that we talk about. And a great recommendation is to really monitor animals whenever you move them and quarantine if you can for about 30 days. Most everything that we've talked about to this point, and will all the way throughout, has an incubation time something less than 30 days. And if you can budget that in there and be on top of your game, managing your animals, most of that, if it's going to outbreak, does so within that first 30-day time frame. Clinical symptoms here in the respiratory form of IBR, gaunt, depression, high fever, again, the snotty nose, the discharge from the nasal cavity. That disease will oftentimes last about a week. And so if they're milking, they'll drop severely in production. So some other things that are listed there, whether it's reproductive tract, we've kind of covered abortion and neonatal diseases. Abortion rates, if it happens to get reproductive, can be 25%, can be fairly significant. So again, vaccination, same protocol, same program. PI3, again, those 7-way, 9-way vaccines are going to cover this most of the time. Again, consult your veterinarian, make sure that you've got a great approach to handling these. Completely different topic here when we talk about tuberculosis. This is a chronic infectious disease affecting cattle, swine, humans, deer. Just about everything is susceptible to TB. And I've got a link here that you can look at some photos of tuberculosis, TB infection in deer in Michigan. It's extremely disturbing to look at, but you can see some of the pustules that it causes inside. So there's three type of infections. All are mycobacterium in nature, all spread by air or contaminated feed and water. They're quite keen on keeping this contained. This is one of the diseases that veterinarians will test for if we have animals going across state lines and so forth. So um, keeping up with where TB areas are is crucial whenever you're moving cattle. Now, Illinois is, I think, considered still a TB-free state, but certainly you get to the northern half of Michigan, they've had outbreaks, and a lot of it in the deer population, but certainly if you have deer that may commingle, even accidentally, with cows in the pasture, could pass it to them, and that's why movement of cattle is sometimes restricted up there. There's no recommended vaccine for TB. So if you find a positive animal, first they're going to flag them and recheck them. Second, they're going to probably slaughter them, and there's really no treatment option. And then if you find a suspected animal in your herd is going to be confined for a period of time until they verify or not whether that was a positive case. Moving on, Strangles is a bacterial disease. This one then affecting horses. We have some lymph node and nasal discharge problems whenever Strangles affects a horse. So again, contagious. This is one that's very common and something to be aware of and having vaccinated for if you're going to have horses moving in and out of stables whenever you're going to be commingling different horses from different locations or taking them to the show or whatever it may be. That commingling sometimes causes Strangles to outbreak and oftentimes hits horses at less than 5 years of age. But again, pretty significant high fever, watery yellow nasal discharge, big time swelling under the throat and jaw, and I think I have a picture of that. If you find it, quarantine those animals again, vaccinate. Recovered horses still can shed this particular problem, so you have to be aware of that. And treatment is, again, isolate them, probably change their feed, go to something a soft, sweet feed or a complete feed of some kind, because they're probably not going to feel like, if you look at this picture of a swollen jaw here on this horse diagram, that they're not going to feel like eating very much, and so you want to keep them on feed. Kind of dialing it in here as we finish up is the porcine respiratory disease complex, very similar to the BRDC, but now just talking about pigs. Again, very similar, a lot of the same pathogens. We know of at least 12 of them, whether it's pseudorabies, Haemophilus, swine influenza, virus, mycoplasma, etc. Again, clinical symptoms all consistent with a lot of the respiratory problems that we've already kind of covered in this particular section. Contributing factors are certainly environmental, and if you think about, again, the confinement systems in which swine are raised with dust and a nice warm environment, you can see why respiratory problems, the PRDC, is a topic that's very, very high on the radar in terms of health management protocol in a swine building. All in, all out has really changed and cut back on the losses from the mortality and morbidity rates of the PRDC complex in pigs, and so that has helped producers a lot. And then they're able to handle dust a little bit differently, deal with the animal dander, get some cleaning done whenever the barn is empty in order to cut the cross contamination from one group to the next. Certainly, whenever you have these types of things, you're going to cut into average daily gain drastically, and it's going to cause increased incidence of susceptibility to other diseases. So that one is one. This is probably one of the top diseases that those of you who are interested in pigs would encounter and certainly be targeted for if you're dealing with pigs in your barn at home. So that wraps up. I was able to get it in all in this 15-minute segment, so you don't have to listen to 2 lectures in this particular section. Make no mistake, though, these respiratory diseases are very problematic, whether it's young stock or old stock. Moving stock around can certainly cut into whatever production parameter that we're looking at. So be keen, work with your veterinarian, have a great herd health management plan targeted at these specific things, and I'm confident they will respond 9 times out of 10. Best of luck.